Hi friends, today we will see emergency drugs. First, injection adrenaline dose 0.5 to 1 mg, route IV, IM or subcutaneous, uses severe allergic reaction, cardiac arrest and bradycardia. Next, injection noradrenaline dose 8 to 12 mcg per minute. Route IV infusion uses hypotension. Next, injection dopamine dose 2 to 20 mcg per kg per minute. Route IV infusion uses hypotension. Next, injection atropine dose 0.5 to 1 mg. Route IV we will give to treat bradycardia, cardiac arrest. Next, injection deriphyllin dose 10 to 20 mg. Route IV uses severe asthma and chronic obstructive pulmonary disease. Next, injection KCL dose 40 to 80 milliequivalents. Route IV infusion uses hypokalemia. Next question, injection furosemide dose 20 to 80 mg. Route IV uses fluid overload and hypertension. Next, injection diazepam dose 2 to 10 mg. Route IV uses seizures, anxiety and alcohol detoxification in DT. Next, injection phenarmin avil next dose to 25 to 50 mg. Route IV or IM uses severe allergic reaction. Next, injection hydrocortisone dose 100 to 200 mg. Route IV uses severe allergic reaction, severe inflammation and asthma. Next, injection nitroglycerin dose 5 micrograms per minute increased by 5 mcg per minute to 20. Route IV infusion uses angina, heart failure. Next question, injection epitoin dose 18 to 20 mg per kg. Route IV or IV infusion uses seizures. Next, injection mannitol dose 0.25 to 2 grams per kg. Route IV uses increased ICP, intracranial pressure. Next, injection haloperidol dose 1.1 to 5 mg. Route IV or IM uses acute psychosis, schizophrenia and mania. Next, injection digoxin dose 8 to 12 mcg per kg. Route IV infusion uses heart fail, heart failure, arrhythmia. Next question. Injection lidocaine, dose 1 to 1.5 mg per kg, slow IV bolus over 2 to 3 minutes. Route IV infusion or slow IV bolus. Uses arrhythmiasis. Next, injection amiodarone, dose 0.5 mg per minute. Route IV infusion. Uses arrhythmias and cardiac arrest. Next, injection adenosine, dose 6 mg, which may be repeated in 12 mg. Route fast IV bolus. Uses supraventricular tachycardia. Next, injection ondansetron, dose 4 to 8 mg. Route IV. Uses severe nausea, vomiting. Next, injection soda bicarbonate, dose 1 milliequivalent per kg per dose. Route IV infusion. Uses acidosis. Next, injection 3% sodium hydrochloride, dose 0.5 to 1 milliequivalent per hour. Route IV infusion. Uses hyponatremia. Next, injection MgSO4, dose 1 to 2 grams slow IV. Route IV infusion. Uses eclampsia and preeclampsia. Next, IV dextran solution, dose 20 milliliter per kg. Route IV infusion. Uses hypovolemia due to severe blood loss. Next, amiodarone. Uses treatment of ventricular arrhythmias, atrial fibrillation and flutter, and cardiac arrest. Route of administration: intravenous, injection or infusion. Dose of administration 150 to 300 IV over 10 to 20 minutes. Next, tranexamic acid. Emergency uses control of bleeding in surgery, trauma and postpartum hemorrhage. Route of administration: IV injection or infusion. Dose of administration 1 gram IV over 10 minutes, followed by a maintenance infusion of 1 gram over 8 hours. Next, ethamsilate. Emergency uses control of bleeding in surgery, trauma and postpartum hemorrhage. Route of administration: IV injection or IV infusion. Dosage of administration 500 mg 1 gram IV every 6 to 8 hours up to a maximum of 2.5 grams per day. Next, octreotide. Emergency uses control of bleeding from esophageal varices. Route of administration: subcutaneous injection or IV injection or infusion. Dosage of administration: subcutaneous injection on 50 to 100 mcg. Next, oxytocin. Emergency uses induction or augmentation of labor, prevention of treatment, prevention or treatment of postpartum hemorrhage, and management of incomplete or missed abortions. Route of administration: IV injection or IV infusion, IM injection. Dosage of administration: IV injection or infusion 10 to 40 units. Next, ergometrin. Emergency uses controls of postpartum hemorrhage and prevention or treatment of uterine atony after children. Route of administration: IM injection. Dosage of administration: 0.2 mg IM injection, repeated as necessary. Next, calcium gluconate. Emergency uses: treatment of hyperkalemia, hypokalemia and certain drugs overdosage. Route of administration: IV injection or infusion. Dosage of administration: 1 gram. IV injection over 5 to 10 minutes. Repeated as necessary. Next, haloperidol injection. Emergency uses: treatment of acute psychosis, psychotic episodes, severe agitation and delirium. Route of administration: IM or IV. Dosage of administration: generally the recommended initial dose is 2 to 5 mg. Next, naloxone. Emergency uses: reversal of respiratory depression and sedation caused by opioid overdose. Route of administration: IV, IM, subcutaneous. Dosage of administration: IV, IM, subcutaneous 4 to 2 mg, repeated as necessary. Next, dextrose. Emergency uses: treatment of hypoglycemia and as source of energy. Route of administration: IV. Dosage of administration: 25 to 50 grams, IV bolus, repeated as needed. Next, vasopressin. Emergency uses: treatment of cardiac arrest and vasodilatory shock. Route of administration: IV. Dosage of administration: cardiac arrest 50 units, IV bolus once. Vasodilatory shock units per minute. Next, thiamine. Emergency uses: treatment of Werking's syndrome, alcohol withdrawal syndrome, and certain types of drug overdose. Route of administration: IV, IM. Dosage of administration: 100 mg, IV, IM, repeated as needed. Thank you for watching. Like and subscribe.